Hi students, welcome to week 2 and chapter 2. And this week we're focusing on turning our clinical problem that we found at the clinical site and turning it into a researchable question. The reason that we're doing all this obviously is because we want to find evidence to support practice. And it's important for the people who are actually providing care to be basing what they're doing on evidence. But there's a lot of things that can interfere with hands-on point-of-care clinicians uh, finding the right evidence. And one of the reasons may be that the people who are, bedside nurses or clinicians aren't really proficient in using computers. Or maybe there really isn't access where they're working to look things up. Um, they may not be really comfortable with their search techniques. They may not be able to access the correct databases, which I said the CINAHL database really is the best database for nursing evidence. And what's probably the most likely thing is that they really don't have the time to search. But we're spending this whole semester really focusing on learning how to search for good evidence to, base a clinical practice change on. So this week we're focusing on the question part. And one of your assignments this week for discussion board is for you to post your response to 3 of the learning outcomes for this week. One of the learning outcomes is to differentiate between a background and a foreground question. So the 2 articles that are posted on the main page of week 2 are really great articles. They're really easy to read, and I think they're really, really good at explaining this whole PICO process. So hopefully, once you read those, you'll have a really good understanding of this week's concept. You may need to go to the textbook for clarification or more specifics, but I think the articles do a nice job. So background questions really provide general information, and background questions are not specific enough for you to search the literature to find information on. You can start there, but you're not going to be able to answer a question with find evidence to answer a question enough to change practice with just a background question. What you need to do is you need to hone your question down to be more specific. And when you do that, you've now developed a foreground question. And a question that's in PICO format is a foreground question. So the PICO format we're going to explain in detail in a couple of minutes. But by turning your question into a foreground question, you're going to be much more likely to find evidence that answers your question. An example of a PICO question is right here. In children aged 3 to 8 years, so that's your P, your population. Children aged 3 to 8 years is the population. How does acetaminophen, that's your intervention part, compare with ibuprofen, that's your comparison part, in lowering a fever, that's your outcome. So again, children aged 3 to 8 years is the P of PICO, population. Acetaminophen is the I of PICO, intervention. Ibuprofen is the C of your PICO, which is your comparison, and lowering a fever is your O, the outcome. You'll notice that you have no T here. You could certainly add a time frame if you wanted to. You could say, in children aged 3 to 8 years, how does acetaminophen compare with ibuprofen in lowering a fever within 2 hours of administration? That would be a time frame. If you really wanted to know something that specifically, then you would ask it that way. But when you go to the literature, you may find that the more specific your question is, the less literature you find. If you find a ton of articles, in the thousands, then your question may be too broad and you may actually have to narrow it down. So, is the following statement true or false? Foreground questions can be answered by consulting an up-to-date nursing or science textbook. Well, what do you think the answer is to that? I'll tell you, the answer can be found in the articles for this week, but it's false. Your foreground questions can be answered by looking in original studies or systematic reviews of original studies. Textbooks are not appropriate for answering foreground questions, and that's why we're going to spend so much time learning how to use CINAHL and how to find appropriate literature and appropriate evidence. So there are different types of foreground questions, and we went over this briefly in our first night of class. We said that depending on what your question is, it's either going to be an intervention question, a prediction, a diagnosis, an etiology, or a meaning question. Here's another question for you. Is the following statement true or false? A well-formulated PICO question should specify the measurable patient outcomes that need to be addressed. Sounds like it probably is true, and it is. Okay, so let's get back to that PICO format. So again, P stands for your population of interest. I is your intervention or issue of interest. C is the comparison of the issue of interest. O is the outcome expected, and T is the time frame, the time needed for the intervention to achieve the outcome, or the time in the course of the disease, etc. If you're going to use a intervention template, then if you had a question that involved an intervention, you would use this intervention template. So again, in blank, your population, how does blank compared to blank affect blank within blank? So can you think of a question to fill in those blanks? How about this? In patients with dependent edema, how does TED stockings compared to elevation affect edema within 4 hours? In which case you would then go to the literature and see what you could find on studies that have been done looking at TED stockings for edema and elevation for edema and comparing and synthesizing the results of those studies to help answer your question. In a prognosis template, your question is really getting at what predicts the outcome. So, an example of this might be, in children with ADHD, how does environmental structure compared to stimulant medication and environmental structure predict school success over one term? That's an example of looking at two different variables and seeing which one predicts school success. In the diagnosis template, you're trying to figure out what is the better way to confirm the diagnosis of something. So let's think of an example for this. How about in males with dysuria, is urine culture or genital swab compared to genital swab more accurate in diagnosing chlamydia? So that would be a way for you to kind of go to the literature and see what is the best way to diagnose chlamydia in a symptomatic male. The etiology template is a question that's getting at the cause of something. So let's think of an example for this. How about, are elderly patients who have dementia compared to those without dementia at greater risk for developing UTIs? I don't think you need a time for that. So what you're doing here is you're trying to figure out if the dementia variable is actually important in predicting or in identifying the cause of UTIs. We know more elderly that UTIs there's an increased incidence in elderly, especially females. but have we looked at whether that rate is higher among those with dementia or not? I don't know. So you can see that if you found that out, you could actually change practice. You would be more careful about screening the patients with dementia for UTI than patients without, theoretically, also basing it on symptoms, etc. But I think you get the idea. The last type of PICO question is the meaning question, and that really gets at sort of qualitative data like we talked about in class. An example might be, how do children with cancer perceive their illness during remissions? So we may want to go to the literature and find out, what does it mean to children who have cancer when they're not sick? What is their perception of their illness? Does it change? And why would this be important? Well, I'm sure you can think about different reasons. Perhaps if children are preoccupied with their illness during periods of remission, it's a great time for them to enjoy some of their favorite things. Might be a good time to plan events, parties, etc. So that's just an example. I'm sure you can think of some others. Which of the following components of a PICO question is absent from the following clinical questions? So we've talked about the 5 components of a PICO question: population of interest, intervention or issue of interest, comparison, outcome, and time. Let's look at the question in the quotes and see which of those is missing. Among patients with dementia, how does the use of reorientation therapy compared with regular supervised mobility affect patient agitation? I think that's pretty easy. You've got your population there because your population is patients with dementia. You've got your intervention, which is the use of reorientation therapy. You've got your outcome, which is patient agitation. But I don't think there's time in there. And that's the answer. So hopefully you guys have a really good understanding of the PICO question and how important it is for you to turn your clinical problem into a researchable question. I hope you understand the difference between background and foreground questions, and I hope you're going to be able to explain that. And then once we've got our PICO questions in good shape, it's time to head to the literature, and we'll begin that next week. Have a good one.